I am Dr. Lakshmi Satish, Senior ENT Surgeon practicing at Cosmetic ENT Care Center and at Sagar and Excel Care Hospitals. Tonsillitis is a condition where there is acute inflammation of the palatine tonsils located on either side of the throat. It can result in severe pain and along with fever. Patient can experience body ache, fatigue and difficulty in swallowing. The patient can also experience some amount of throat irritation and cough and difficulty in swallowing food. So the condition can be diagnosed by the doctor appropriately after taking a detailed history and examination of the throat. Examination of the throat reveals congestion of the throat and swelling of the tonsils. The tonsils can be very much enlarged and there can be multiple pus-filled follicles when we call it as a follicular tonsillitis. Or there can be a dirty white membrane on the tonsil when the infection is very severe, when we call it as a pseudomembranous tonsillitis. So based on the type of the infection, we can call it as a acute parenchymatous tonsillitis or acute follicular tonsillitis or acute pseudomembranous tonsillitis. The treatment for this condition is a strict rest in bed, analgesics, patient has to do saltwater garglings, and if the patient is febrile, definitely we'll have to give antibiotics appropriately because the antibiotic will result in resolution of the infection completely. Otherwise, just by taking some painkillers, the infection can prolong and it can lead to some complications such as peritonsillar abscess or quinsy. Therefore, appropriate timely institution of treatment is of paramount importance. Otherwise, even the infection can ascend to the sinuses and to the ears, giving rise to otitis media in children, sinusitis or laryngitis in children, and it can also descend down to the lungs causing bronchitis. Therefore, appropriate institution of the correct antibiotic and completion of the course is very important. Along with that, we have to give supportive measures such as rest in bed, frequent warm saline gargles, adequate hydration. Parents have to give nutritious food for the child or the person who is affected, and rest is also very important. Coming to the preventive measures, wherever a person suffers from an acute infection, they have to isolate themselves and not go to the office and work and spread the infection to others. Even in the schools, they have to enforce that any child who is very sick with a fever and a severe sore throat should be given a leave of absence so that one child does not spread the infection to others, because timely help is very, very important. Analgesics, then antiseptic goggles, good hydration, all that will cure the condition. If the child or a person suffers from repeated such attacks, then the person will be labeled as having a chronic tonsillitis. The tonsils will be swollen, infected, there will be pus-filled follicles, and there can be persistent lymph nodes in the neck. These can also lead to chronic tonsillitis. The triggering factors for these tonsillitis attacks can be inhalation of very cold wind, exposure to another person having infection, or eating lots of ice creams or any ice cold beverages can sometimes trigger these infections. Such susceptible individuals should be careful. If a person suffers from chronic tonsillitis, the last resort would be a tonsillectomy, because tonsils, which are supposed to meant to guard the body, instead of guarding, if they themselves are harming repeatedly, then that person is a candidate for tonsillectomy operation. Thank you.